Hi, my name is Manikanta Vemireddy, and I'm currently a practicum student of first and second period, and it is May 2023. I also go by Money. So I just want to quickly say that this video is going to be a bit long, and it's just going to be me talking at this screen, but honestly, it's going to be really informational, so you'll be able to use this as a resource if you want to, as you progress through the year as a practicum student. So just keep that in mind. Okay, so I want to first start off and say that joining practicum is an amazing opportunity. I know you probably have heard that. That's probably why you want to do this, but I can't stress enough that throughout this year, you're going to experience a lot of things a normal high schooler is not going to experience, especially through the opportunities of shadowing physicians, nurses, techs, etc. It will be uncomfortable at times, but everything that's worth it is going to be uncomfortable. And just know that you're not going to be alone in that situation. I've been uncomfortable when I first started, and so has the generation of practicum students before me, and so will the future students after you. Also, use this as a resource because you're here to basically learn will you go into this medical field? You're only 17 or 18, so obviously it's not gonna be a set path for you. You're just gonna narrow down some of your career choices, which is why this class is so important if you do decide you want to go into the medical career or just STEM in general. This is practicum in STEM. Okay, so let's get into opportunities. By the time you're watching this video, you're probably around the time to choose a site, and just understand that you can change your site, but finding multiple sites at a time is a little difficult. But I know if you're truly dedicated that you can do it. And your practicum experience will depend on which site you go to. Trust me, I have peers that have gone to 3 sites, have been unhappy with all of them. I know people who've only been to one, and they stayed there the entire year because of how much they enjoyed it. So sites really do matter. I'm going to be as transparent as possible. Do your research on your sites. Not every site will be available to give you the highest level of attention, to say, because the environments you're going to be in are going to be running clinics, veterinary centers, hospitals even, and veterinary centers do offer students more opportunities to learn. I would have to say, I currently shadow in pulmonology, and the doctor I have is amazing, Dr. Sint, and he has helped me so much to grasp what exactly I'm looking at when we go patient to patient. But there are so many various medical places you can go to, STEM related areas. So just do your research, and Mizuma will give you so much time in the beginning of the year to really understand how practicum works, and she'll be there to answer all your questions. Towards the middle of the year, I would like to say that's the time I went around, you'll have an opportunity called Seton. So you'll be shadowing at, I believe it'll be Seton Northwest this year. Well, depending on the year you see this video, but I'm talking about the 2024 year. And basically what Seton is you will go to that hospital and you will go on clinical rotations shadowing different floors. So for example, I could go to Seton on, I was Monday, Wednesday, so I'll be going on Monday, I'll be going to a floor called Med-Surg. And then Wednesday, I could completely change wherever I'm going to, and I'll be going to nursery, So you'll have 10 rotations you can go through. And it's honestly probably the best time I ever had in practicum, because you'll get your own ID badge, and yes, you will use it, which is pretty cool. But you really feel you're part of the medical team. Obviously, you're not going to be performing any medical tasks, but just being there with whoever you're shadowing, a tech or a nurse, it's just being in that environment kind of envelops you, and oh my goodness, I'm actually here, I'm actually on an OR floor, oh sorry, not OR floor, you probably will not be in an operating room unless you're doing an endoscopy, which is also really cool, by the way. But Seton hopefully you do get the chance to go. I'm pretty sure there are limited spots, but if you feel as though like you haven't really understood what you wanted to do yet, like in practicum, scene is an amazing opportunity to figure out like what exactly your place is like in this medical setting, especially going to like such a large hospital. It really like you get to see various people doing like various jobs and stuff like in their own environment, which is really cool, and it's something that's kind of overlooked, but I think is something that you should really pay attention to. Like even like the janitorial staff, like just having a quick conversation with them, you can learn so much about what exactly how the way like things work in this hospital. Okay, and then I know a lot of you, this is your senior year most likely, so I was in the same boat, but senioritis is going to hit you one way or another. You might be seeing this first or second semester of the year. Usually senioritis hits second, but for me, like it hit as soon as I walked through the doors of Anderson my senior year. But workload wise, this will probably be one of your most chillest classes of the year, and I don't say that lightly. Like I did a lot of dual credit and AP classes my senior year, but this class was really there for me like as a work block. Obviously, there will be a like assignments you have to do like skills packets, but you can crank that out in like 30 minutes or less, and then like the rest of the time like you can just work on whatever you need unless Ms. Zumal has something else planned. Just know that when you do go to your sites and stuff, like wherever you go, whatever you're doing, that you will have a journal you're gonna have to maintain and probably do 5 medical terminology words that day. It's really not that big of a deal. Like I'm sure like most of y'all in this program already take upper level classes. So just understand like this class is not gonna be like an AP level class. Like it's an opportunity to learn and grow. So like just keeping a small journal, it should not be that big of a deal. Let's see. The next thing I really want to hit are these skills packets. They were the bane of my existence. Like, and Ms. Zuma knows that very sure. I think I complained about it every time she gave me one. But honestly, some of the things in these packets, even though they are a bit cliche, actually do kind of help you in a way. Especially like when you're going to like a hospital after hospital, like clinic after clinic, trying to like talk to people. It kind of gives you a bit of like tips and tricks on like how to like navigate that, because some people will have to go to like multiple clinics before they find one that really like basically hones what they want to do. So moving away from all of that, like basically like the grittiness of practicum, I want to talk about my time in practicum, basically how like my experience was. So during my time of practicum, my junior year, there was a application interview process, and only a select few of us were able to do practicum. But then that changed because more funding was given, or I'm not 100% sure what happened, but a second class was added because people who didn't get accepted in the first round, which I was, they kind of fought for another practicum class. So hopefully like by the time you're viewing this video, there's still 2 classes, which is really nice. But for me, like I always wanted to do practicum. Like even when I was a freshman, I wasn't actually at Anderson. So when I came here, like it was like going into my sophomore year, like I knew there were opportunities like that available. I just didn't know how to like get into it. But I knew like since my freshman year, like I actually went to Leander High School, that I wanted to do something medical related my senior year because of how cool it is to even have the chance to do something like this. I shadowed in Austin Pulmonology. Austin Pulmonary Consultant is the official name of it. And basically like what I did was, also pulmonology is like the study of lungs and stuff, you did not know that. Basically what I did is I shadowed this doctor named Dr. Thawsint, and me and him were basically a duo, and like we went, like I basically just followed him like throughout his day. His day like mainly consisted of charting and seeing patients, and so like I was actually in like the patient's room and observed everything, which was really cool. I'm not 100% sure like how many people were able to like see like actual patients. Obviously, you know, it depends on like wherever you go to, but for me, like I was really grateful to have like the chance to actually work and see patients, which is really nice. And another cool thing about what I did, like where I shadowed, is that not only did I get to shadow Dr. Synth the entire time, but um I went to various clinics. It was all pulmonary consultants with Dr. Sin. It was just various locations. So I saw like a very, 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 very wide array of like medical staff as well. And like I got to talk to like all of them. It was really cool. Obviously, like wherever you go to, it could be different. So like don't get too down on yourself if you don't have as cool of an opportunity as others. Like any opportunity you get is still better than nothing. So just understand, wherever you go, you will learn something. My mouth's kind of dry. And then one more thing about Seton, you might be going into it thinking you'll be shadowing doctors. For me, at least, and like the times previous students have gone to Seton, you will not be shadowing a doctor. So just get that out of your mind. The chance of you shadowing a doctor is extremely low. And the case is, and like even though you won't be shadowing a doctor, you will be shadowing a nurse or a tech or a student or like just someone like who's a little bit above you, like in the hospital. And those people will give you the most educational day of your life. They truly do cherish all of the students that come through their halls. So they really take the time to allow you to like understand what exactly they're doing, what medications they're giving to patients, how their day is basically going. So just know that even if you're not shadowing a doctor, it does not mean that you're not going to get a good experience out of Seton. My favorite floor of Seton was MedSurg. Personally, I fell in love with that place because of how fast-paced it was. I think I saw like 14 patients every time I went to MedSurg, which was a total of 3 times, because I just liked walking like patient to patient, checking to make sure everything was okay. I just liked the fast-pacedness. And also, it only took me 1 time to find a doctor to shadow. So it's not too bad. So don't stress too much about it. Because I know like during my time at least, a lot of people were stressing over like, am I going to get a doctor? Like, will I have a doctor to shadow? Where do I go? Like, it really does not take too long to find a place. What I took away from practicum this full year, was that on one hand, it did give me a clear mind, a clear roadmap of what I wanted to do in the future, which is medicine. I do want to pursue medicine and go to medical school. But it also confused me in the sense, like, there's so many so many occupations you can have in, like, the medical field. So you're not only limited to like, you know, they do the standard doctors, nurses, you know, stuff like that, but there's so many jobs that you can have that are good paying, are like amazing fields to study as well. So that is something that I will be taking forward with me when I move on to college. And I also want to stress this the most. And if you take anything from this video, please take this piece of advice. You're still teenagers, okay? Like, you are still teenagers. You are going through your senior year. Just have a good time. There will be a time where, like, you will have to, you know, become an adult, but you have so much time to figure stuff out before then. Like, don't worry about, like, figuring out, like, if you're going to become a doctor or not, you know, if your parents want to, stressing you into that. Like, it's not that big of a deal. You were only, like, 17 or 18-year-olds. Like, just take your time, relax, enjoy the experience that practicum will give you. You can ask Ms. Zuma herself that students stress over things that they really need to be worrying about like 5-6 years into the future, you know. Obviously, don't completely like throw away like any stresses in your life, like regarding college and your future, but just like whatever stress level you're at right now, just bring it down a notch, because it really is not that big of a deal. If you have any questions about anything I talked about, Ms. Zumal is an amazing teacher and an amazing resource you can talk to. She's more than happy to help you in any capacity that she can. And you may not even know me because you might be watching this video 3 years, but I do know a couple of the students going to practicum like after me, and hopefully you take the advice that I've given you and you pursue something that truly interests you. Thank you, and good luck on your journey.